Hi, I'm Jean Wong, Residency Program Director at the University of Michigan Department of Family Medicine, as well as an alumnus of the program. I love our program and our community and would like to tell you all about it. You can receive excellent training to be a fantastic family physician in any number of residencies, and I'm not going to try to tell you that we're better than the others. But I will say that in our program, there's not much that you have to give up when you join us. We are devoted to providing excellent patient care, personalized full spectrum education, and to creating a close-knit, supportive community of family physicians dedicated to the principles of health equity and diversity. Our goal is to prepare you for whatever job you want, be it community, academic, inpatient, obstetrics, private practice, research, or anything else in our broad, wonderful field. We're a relatively large program, admitting 13 residents per year. Our overall faculty body is also rather large, with over 100 faculty, many of whom have active, visible teaching roles within the residency program. But our leadership group is smaller. You'll meet our assistant program directors in just a minute, and we also have 6 principal faculty who help design and implement our curriculum. That still leaves another 100 faculty members in the department, which sounds like a big number and is. But you will find when you come to meet us that the residency is so integrated into all aspects of our department that it feels like a very intimate environment, and we are still very much one community of family physicians. We are located in the Ann Arbor area. Ann Arbor is a quintessential college town, and the University of Michigan is its beating heart. By coming to train and live here, you'll be joining a really vibrant, creative, progressive community. And we aren't limited to the city proper, which you'll hear about in a second. We do have 3 match numbers in ARIS and NRMP. Every resident matches into one of our 2 continuity clinics in neighboring Ypsilanti, Michigan, or Chelsea, Michigan. 1 resident per year can also match into our Spanish language and community medicine track, which is primarily housed at our Ypsi site. I do want to clarify that all of our residents get equal training and have the same curriculum, and all of our residents do at least some portions of their training at each one of our sites. But before we get to that, I want to tell you that we are a part of the National Clinic First pilot project. What that means for you is that we've taken a very close look at how to optimize your clinic training, because that's such a core aspect of family medicine. Rotations are 2 weeks long, and most of them are done twice in a year. We alternate more intense rotations, often on the inpatient services, with lighter outpatient rotations. So you might have 2 weeks of night float, but that should be followed with 2 weeks of electives, which helps reduce your burnout. As a Clinic First program, our residents are also exempt from some of the regulations surrounding the timing of their continuity clinics. And so you never have to rush from an inpatient service in the morning, try to wrap up all of your patients by noon, and try to finish rounding and book off to the clinic at 1 p.m. When you're on inpatient, you're on inpatient. And when you're on outpatient, you're on outpatient, reducing the chaos of your day and allowing you to focus. The curriculum really relies on principles of continuity of care, as well as team-based care, to be supportive of your education. And while we're on the topic of schedules and burnout prevention, I also want to let you know about our call system. We do work with a night float system, which many programs do, with residents doing 2 two-week stints of night float per year. There are still a few 24-hour calls left in the residency. For most residents, this results in 4 24-hour calls in the second year and 4 24-hour calls in the third year. Interns have no 24-hour calls. Our residents also train at 2 separate hospital sites. First, the University of Michigan Hospital in Ann Arbor, and secondly, St. Joseph Chelsea Hospital in Chelsea, Michigan. The University Hospital is a world-class hospital with over 1,000 beds. It is connected to Mott Children's Hospital and Von Voigtlander Women's Hospital. The Michigan Medicine System provides training from and access to world-class faculty across all specialties, and a wonderful community of residents in other fields to work beside and build a community with. On the other side of the coin, St. Joseph Chelsea is a community hospital with 133 beds. Our residency has been integrated into the smaller community for decades, and our residents are often the only trainees in this hospital. At the university, you will see some zebras, and you'll have some very complex, very ill patients. At Chelsea, you'll learn bread and butter inpatient medicine. And on our family mother-baby service, we will perform low-risk deliveries, triage pregnant patients, and take care of newborns. On all 3 services, we are not competing with other departments or other specialists for our patients. because you will admit patients who get their primary care from a family medicine physician in our department. They are admitted to a family medicine service, working with a family medicine team under the supervision of a family medicine attending. During your internship, you will also learn inpatient cardiology from cardiologists, critical care from pulmonologists, and inpatient pediatrics from pediatricians. In your second and third year, you will similarly get to work with experts in their specialty outpatient clinics while retaining continuity with your own patients in your home clinic. Now, I think you've heard enough blathering from me, so I'm going to turn this over to Dr. Greenberg.
Hi, my name is Jenna Greenberg, and I am the Assistant Residency Director at the Chelsea Continuity Site. The Chelsea Health Center is located about 9 miles west of Ann Arbor. 22 residents, along with faculty and staff, serve a diverse community and patient population. Chelsea is a small town of about 5,000 people. Our clinic also serves the more rural surrounding communities. With a multidisciplinary approach, we work alongside medical assistants, nurses, social workers, and pharmacists, along with several specialty consult clinics, including cardiology, physical medicine and rehab, and nutrition services. We do all of what you would expect in a family medicine clinic. From newborn care to geriatrics, well care to chronic conditions, obstetrics, and office procedures. For example, on our Thursday morning procedures clinic or Friday morning women's health clinic, you may find yourself doing cyst removals, skin biopsies, joint injections, toenail removals, vasectomies, IUD and Nexplanon placement, endometrial biopsies, or colposcopies. These are all supervised by our family medicine faculty. It makes for a fun and lively environment to work.
Hi, my name is Laura Heinrich, and I'm the Assistant Residency Director at the Ypsilanti Continuity Site. The Ypsilanti Health Center is located just east of Ann Arbor and west of Metro Detroit. 18 residents, along with faculty and staff, serve a diverse community and patient population. With a multidisciplinary approach, we work alongside medical assistants, nurses, social workers, and pharmacists, as well as several specialty consult clinics, including psychiatry, endocrinology, gynecology, and nutrition services. Our diverse patient population includes, but certainly isn't limited to, those who identify as LGBTQIA, African American, Hispanic, Middle Eastern, and West African, among many others. We do all what you'd expect in a family medicine clinic, from newborn care to geriatrics, well care to chronic conditions, obstetrics, and office procedures. For example, on our Friday morning procedure clinic or on our Wednesday afternoon women's health clinic, you may find yourself doing cyst removals, skin biopsies, joint injections, endometrial biopsies, contraceptive procedures, or colposcopies. These are all supervised by our faculty family medicine physicians. It makes for a fun and lively environment to work.
Hello, I'm Dr. Tom Bishop, and I am one of the assistant residency directors who oversees our behavioral curriculum here at the University of Michigan. The community medicine curriculum is something that I'm also involved in, and we're really excited about the direction that it's taking. There's this very strong piece of trying to get residents out in settings that are outside of the academia and really have a very strong focus of giving to the community and really meeting patients in those areas where there are a great deal of psychosocial needs. And so, for example, one of them is the Luke Clinic, which is in Detroit, and it focuses on women's health, pregnancies, those sorts of issues. And it's a very rich experience. I'm sure the residents can tell you a lot about it. It's been a good addition. We also have residents involved in some other community FQHC types of places, such as the Corner Clinic, the Hope Clinic, Packard. And in the Hamilton Clinic is a site that we've just added, and it's up in Flint, in an area where it's very strong needs around substance abuse and treatment and other primary care needs. We really are excited to have residents in these places because they're very different than the continuity clinics that you'll be involved in a large part of the time.
Part of what makes us family physicians is that we love all of medicine. We enjoy working with adults and children, delivering babies, doing procedures, providing compassionate end-of-life care, doing inpatient medicine and outpatient continuity care. We want to do scholarly work, to educate learners, and to be advocates for health equity in our community. We love any and all patients. You may be looking at residency programs in much the same way, trying to find the combination of factors that gives you everything you want. You might look at one program and really love the environment of their community hospital, but worry that you might be giving up something in an academic environment in a medical school. Or you may really like an urban clinic, but feel like you're missing out on a more rural population. We hope that you'll consider our program, because at the University of Michigan, we don't want you to trade one experience for another. We want to give you both.